Hi everyone, so my name is Tessa, and for this week's reflection, I want to respond to prompt number 3 by talking about one of Dr. Cameron John's four metaphor and how it's connected to racism in healthcare. Something that's really important to me as I prepare to work with patients from all different background, and it doesn't matter where they came from. So one of the reading that stood out to me the most was How Racism is Bad for Our Bodies by Olivia Gohill 2020. So the article explained how racism isn't just a social issue, it's also a serious health issue, and it can cause chronic stress that actually damages the body over time. So that idea really hit me, and especially because I'm training to be someone who's supposed to care for people health. So every time we go to clinical, we go to nursing school, our teacher professor always said that we need to know our bias, and then we leave our bias at the door when we see patient. Um, so a quote from the article that really stuck with me was from Dr. David William. He says a black person with a college degree still had a lower life expectancy than white people who didn't finish high school. Go here 2020, pain number 4. So that line make me pause because I've always believed that education and access to care lead to better health outcomes. And yes, they do, but this shows that racism is still a factor no matter how much someone works to improve their life. And this made me think of Dr. Cameron John, dual reality metaphor. In her TED talk, she described it walking by a restaurant that had a sign that say open, but only some people can see the sign. For order, often people of color. And the restaurant looked closed, even though it's supposed to be open to everyone. Um, John 2016. Is this from the video from 2 minutes to 3 minutes? And that's what racism is like. So from the outside, things like healthcare or education may look fair and equal, but in reality, the system doesn't treat everyone the same. And as a nursing student, I have always started noticing this during clinical and at my job. I've seen how some patients, especially those from racial or ethnic minority backgrounds, seem more hesitant to speak up or question the care they receive. And I remember one patient, a black woman in her 40s. She came in for the high blood pressure, and she told us she'd been dealing with it for four years, but felt like her doctor didn't really listen to her concerns. She said, and the only way tell her that it's stress or just because of she worried too much, and that's kind of stay with me. So this related back to Go Hugh article. We talk about weathering. The idea that long-term exposure to racism actually wears out to the body. Go Hugh 2020, pain number 6. So this isn't just about individual behavior or genetics. It's about the chronic stress of always having to prove yourself. So being treated unfairly or not feeling safe in the places that are supposed to help to you heal. And one of the most heartbreaking examples from the article is how black women are 3 or 4 times more likely to die from pregnancy related cause than white women. So, and that's true even when they're wealthy and educated. Go Hill 2020 from page number 8 that tell us racism, not income or education, is a key factor. So when Dr. John talked about dual reality, it reminds us that we can't assume everybody experiences the world the same way. Just because a clinic say it's open doesn't mean every patient feel welcome, safe, or heard there. So as a future nurse, I want to be someone who notices the difference between what the science say and what the patient is actually experiencing. And I want to ask myself, is the person really being heard, or they being treated with the same level of care and urgency as anyone else? That's how we start to break down the invisible barrier by recognizing them first. So to wrap up, Dr. John dual reality metaphor helped me to understand that part of my job isn't just giving medicine or checking vitals, it's also being aware of my patient life experiences and making sure I don't become another person who ignore the side they're seeing. Thank you so much for listening.